Welcome back to MENA Health Focus. I'm your host, Salma. Today, we are discussing a crisis that is silent yet deadly. It affects every family in the Middle East and North Africa. We are talking about stroke, aneurysms, and the critical shortage of doctors who can treat them. Joining me today is the lead author of a landmark new paper published in Neurological Research. He is from the Stroke and Neuro-Intervention Center at Alexandria University in Egypt. Please welcome Professor Ossama Yassin Mansour. Dr. Mansour, welcome.
Thank you, Salma. It is a pleasure to be here to discuss the NITA-MENA study.
Dr. Mansour, your study covers 19 countries and nearly 700 million people. Before we get into the numbers, can you tell us what motivated you and your colleagues to launch this massive investigation?
Well, Salma, as practitioners in the region, we knew anecdotally that we had a problem. We see patients arriving too late or being transferred from hospitals that simply don't have the tools or the trained hands to help them. But until now, we didn't have the hard data. We needed to quantify exactly how big the gap was between the care our people need and the care they are actually getting.
And the data you found, it's quite shocking. Your paper states that the region has only 19.1% of the required neurointerventionists. That means we are missing more than 80% of the workforce we need?
That is correct. To meet international standards, which is about 2.5 specialists per million people, we are critically understaffed. And Salma, that 19% is an average. When you look closer at the map, the inequality is heartbreaking.
I noticed that in the report. You compared high-income Gulf states to lower-income nations. What did you find there?
It is a tenfold disparity. In high-income countries like Qatar or the UAE, the coverage is around 50 to 60%. It's not perfect, but it's functional. But in our low-income and conflict-affected countries, places like Yemen, Sudan, Syria, and Mauritania, the coverage is effectively zero. Our study found no comprehensive neurointervention centers in those 5 nations.
0 comprehensive centers? So if someone in a rural area of Sudan suffers a ruptured aneurysm, what happens?
Tragically, without access to these life-saving procedures, the mortality rate is incredibly high. We estimated in the study that between 115,000 and 130,000 people in our region die preventable deaths every single year. These are deaths that could be stopped if the right doctor and the right equipment were there.
That is a staggering number of lives lost. Dr. Mansour, you used a very specific term in the study, Comprehensive Neurointervention Center. You found that only about a third of the hospitals you surveyed met this standard. Why was the bar set so high?
Because stroke doesn't respect office hours, Salma. To be a true comprehensive center, you cannot just have the machine. You need a team available 24 hours a day, 7 days a week. You need to be able to handle emergencies like mechanical thrombectomy for stroke, but also elective procedures to prevent bleeds. We found that while 80% of hospitals do some procedures, only 33.6% can do it all, around the clock.
And one of the biggest barriers you identified was a lack of faculty, people to teach the next generation.
Exactly. This is the bottleneck. You cannot build a workforce if you don't have teachers. Currently, the entire region is only graduating about 96 fellows a year. To close our workforce gap within a reasonable time, say 8 years, we need to be producing 171 graduates a year. We are running at half speed.
It sounds daunting, but I know your paper didn't just list the problems. You proposed a very specific solution involving training hubs. Can you explain that?
Yes, we cannot expect every hospital to become a university training center overnight. That is impossible. Instead, we identified 28 specific hospitals across the region that are already doing high volumes of work.
So these are the centers of excellence.
Precisely. Our proposal is to strategically develop these 28 centers into regional training hubs. If we can support them to each train just 6 fellows a year, we can close the operator gap in less than a decade. It is an achievable goal if we have the political will and the funding.
And you also mentioned standardization, because right now, a doctor trained in one country might not be recognized in another.
That is a major hurdle. We need a unified pan-regional certification, a MENA board, if you will. This would allow doctors to move from countries with a surplus of training capacity to countries that are desperate for help.
Dr. Mansour, reading your conclusion, one sentence really stuck with me. You wrote, "What this region lacks is not talent, but tools."
I believe that deeply. We have brilliant young doctors in Egypt, in Jordan, in Pakistan, in every country we surveyed. They are eager to learn, they want to save lives, but they lack the fellowship spots and the cath labs. If we invest in training today, we save lives and economies tomorrow.
A powerful message. Dr. Ossama Yassin Mansour, thank you for leading this vital study and for joining us today to explain it.
Thank you, Salma. It is my hope that this data drives real change.
And for our listeners, we will link to the full NITA-MENA study in our show notes. It is a dense read, but an important one. Until next time, stay healthy.